That's why, at the direction of President Biden, FEMA has increased its support. On his second day in office, President Biden directed FEMA to fully reimburse states for the cost of National Guard personnel and other emergency costs. Today, we're announcing that we will go even further. We will fully reimburse states for the eligible services they provided back to the beginning of the pandemic in January 2020. That means the states will be fully repaid for things like masks, gloves, and the mobilization of the National Guard, and they can use the additional resources for vaccination efforts and emergency supplies moving forward. This reimbursement is estimated to cost a total of $3 to $5 billion and is only a small share of the resources that states need to fight this pandemic, including for testing, genomic sequencing, and mass vaccination centers. So to fully support states, tribes, and territories' needs to contain the pandemic and vaccinate their population, President Biden is requesting $350 billion from Congress in the American Rescue Plan. As the president has said, this is a national emergency, and we are treating it as such. We're bringing the full force of the federal government to partner with state and local leaders in this effort. We are giving Americans the facts they need, and we're working to ensure our response is fair and equitable. We are doing all we can, but it is critical that Congress does its part as well. We need Congress to quickly pass the American Rescue Plan to give us the funding we need to continue to scale up our vaccination program and to provide the resources that state and local leaders need to protect their communities and fight the pandemic. And with that, I'm happy to take a few questions.
Thank you, everybody, for joining. We have time for a couple of questions from Jeff today. First, we will go to Carl O'Donnell with Reuters.
Hi, this is Carl. Thank you for your time. So, I guess what would be helpful would be just to understand, first of all, you mentioned 6,500 pharmacies in the program originally. How many vaccine doses do you think are going to be pushed through that on a weekly basis? And also, just want to confirm that for that $3 to $5 billion, does that require the Congress to pass any legislation allocating funds, or is that something FEMA can do from its existing funding? Thank you.
So 1 million doses will be allocated next week to those 6,500 pharmacies. So that's in addition to the 10.5 million doses that are going to go to states, tribes, and territories. That's the first phase of the pharmacy program. And we'll phase up, as I said, as supply increases. On your FEMA question, no, that does not require Congress acting. That's a decision that the president has made, and we will reimburse states that $3 to $5 billion.
All right, next we'll go to Kaitlan Collins with CNN.
Thank you very much. I have two questions for you. One, on this rollout, given you just said this is in addition to the 10.5 million that you're already sending. So where are these vaccines coming from? This 1 million that you're going to start sending out, what allotment is this coming from that you have? And then secondly, you said to make sure that you can meet the eligibility guidelines before you go to try to get a vaccine at these pharmacies. A lot of states are in different phases of distribution. So is the federal government recommending that those states open up their eligibility so it's the same across the board and therefore a little less confusing for people?
So first of all, Kaitlan, thanks for the questions. Good questions. The additional 1 million on top of the 10.5 is consistent with Moderna and Pfizer scaling their operations. We're doing all we can to monitor and help the manufacturers produce as much vaccine as possible. So the increase of over 20% that's happened since the beginning of the administration, that's going directly to states, territories, and tribes, plus this 1 million to pharmacies directly, is all a result of the manufacturing scaling up. And we hope that we can do all we can, and we will do all we can, to continue that scale up to make more vaccines available. Your second question was on states. Each state does have its own policy, and individuals should check their own state policy for eligibility. You will recall that President Biden a couple of weeks ago did call on states territories, and tribes to move as quickly as possible to make all people 65 and over eligible in their states, and more than half the states have done so. That's an important population. More than 80% of the over 400,000 deaths that this country has suffered have been in people that are over 65 years of age.
Next, we'll go to Zeke Miller with AP.
Thanks for doing the call. Jeff, could you, on the pharmacy allotments, could you speak to how those 1 million doses per week will be distributed across the country? What metric will be used to sort of ensure equity in terms of the distribution will be population-based? And then on the president's call for Congress to pass legislation, how much quicker would the pace of vaccination be with additional congressional funding? And conversely, how much slower would it be without congressional action?
Pharma, thanks, Zeke. And again, good questions. On the pharma allocation, it's allocated the same way we allocate to states, tribes, and territories based on their populations. However, the Center for Disease Control, which has quite a bit of experience working with pharmacies, is making sure that we are picking pharmacies in that first phase that are located in areas that are harder to reach to ensure that we have equitable distribution of the pharmacy doses. And across the board, as you know, equity is foundational to everything we do. On the American Rescue Plan, we're doing all we possibly can with the resources we have, and we will continue to do so. The faster Congress acts, the faster we can scale vaccination sites, mobile units, we can increase testing, we can increase emergency supplies. So given this pandemic, it's important that Congress act as fast as possible so we can scale our efforts and fight the pandemic as efficiently and effectively as possible.
All right, we have time for a couple more questions. We're going to go next to Elizabeth Weise with USA Today.
Hi, thanks so much for taking my call. A question about production. The states report that they get fluctuating amounts of vaccine every week, even though they're ordering the same amount each week. Is it that production coming out of the Pfizer and Moderna plants varies by week, or what is causing that fluctuation?
Well, Elizabeth, that is one of the messages we heard loud and clear through the transition, was that it was very hard for states to plan to most effectively vaccinate their populations without a better sense of what their shipment was likely to be the following week. And that's why we, since we've come into office, have given a minimum of 3 weeks of visibility. So this morning when I was talking to governors about 10.5 million doses being distributed, that's not only for the next week, but it's for the next 3 weeks. And that allows them to plan accordingly, to know what staffing to have, what centers to open. So I think historically, there had been fluctuation. We are very tuned into not having that fluctuation, and we are guaranteeing minimum levels of distribution to the states of doses for the next 3 weeks. And we started that last week with 10 million. We've moved that up to 10.5 million for the next 3 weeks. So it's really important that states know what's coming. And as production increases, we hope to increase those minimums across time, but always give the 3 week visibility so states can plan accordingly.
Thanks, Sid. Last, we'll go to Ann Flaherty with ABC.
Hi, thanks for taking my question. Jeff, do you have any sense of how the weather has impacted on the East Coast, has impacted the rollout of these doses? And also on the FEMA-run sites that the president wants to set up, there are some that are already in place and supporting vaccination sites. Are we going to expect to see more along with the pharmacy rollout, some FEMA-run sites?
Good questions, and thank you. First, on the weather, I talked to General Perna earlier this morning. All vaccine doses have been available to the states on schedule. Unfortunately, as you know, given how hard the storm has hit some locations, some vaccination sites have had to close or limit their hours. So in terms of vaccine distribution to the states, that's all worked as planned, despite the challenges of the weather. In terms of individual vaccination sites in certain parts of the country that have been hard hit by snow, some of those sites are closed and people are being rescheduled for later in the week. On FEMA, we have had a very active first couple of weeks with more than $1.7 billion going from FEMA to the states to support vaccination. Some of these sites were already started, and we've helped with technical assistance and resources to bring them to a higher level. There are other sites that are being set up that are going to be run by the federal government with the help of FEMA, potentially military personnel, doctors and nurses, et cetera. So we're making a lot of progress. We will meet and likely exceed the president's goal of having 100 community vaccination sites up and running by the end of his first month in office. And at the same time, we're also utilizing mobile vaccination units to make sure that we're reaching hard-to-reach communities, again, with equity being first and foremost as a foundational principle of our vaccination program. So I think that brings us to the end. I want to thank everybody and really appreciate the interest, and we're doing everything we can to effectively vaccinate individuals across the country. We really do need Congress to act and pass the American Rescue Plan to help us expedite our efforts and make them more effective and more efficient. Thank you.